have Dr. Don Pelto. He was one of the speakers before where my staff, I was talking about who do we need to come speak, and his name was first on the list. My staff loves his protocols and his efficiency with Athena. So really, I think we're all lucky he's willing to do this for us. So please welcome him and ask him questions at the end and pick his brain.
Great. Thank you so much. My name is Don Pelto. I'm in private practice in Massachusetts. And I'm kind of like I try to be like the efficiency king, because I know you're all the efficiency queens here, but I try to be, there's no, just all women here. So I'm going to talk about how to make the visits work better, how to streamline the office visit to reduce time vampires. You know what the time vampires are? The things that like occupy all the doctor's time. How to simplify communication and sharing patient education. I'm kind of a techie person too, and so I think the more we can use technology, the easier this all does. So I have a little podcast called Podiatry Practice Mastery where I talk about practice management things, and so that I'm going to talk about that. So I like to divide the whole patient process into before, during, and after. It's really easy. So we're going to look at efficiencies that you can do before they come in, while they're in the treatment room, and then being more efficient afterwards. So let's start with before. How to make the patient visit work better with appropriate preparation. So before is always the preparation. My biggest thing, my favorite patients are the ones that have already gone to my website and they've looked at my blog article on plantar fasciitis, they've watched the 20-minute video, they know what I'm going to do, and then they come in. Like those are by far the best patients, or the patients that have found me on YouTube and they've watched my whole video that I have there. Like those are by far. Does anyone send patient education information out before the visit? No one does. No one at all does. Okay. A thought behind that is it's a term that we don't use too much in podiatry, but it's called positioning. So positioning. Let me give you an example. If you had a patient coming in, they made the appointment, and then all of a sudden you send them something in the mail or via email, and what's included there is a 100-page PDF, a book that the doctor wrote, the podcast that they have. So they come in thinking that doctor is like a superstar. So that's called positioning. So then whatever the doctor is going to recommend, they're more likely to accept it. A lot of times it comes in if someone refers them, right? They kind of do the same thing. They talk up the doctor, or if another doctor refers the doctor, they talk them up. So all of this is called positioning. So if they learn everything, now the concern that doctors have is like, well, if I teach them everything, they're not going to come in. I've had so many doctors, they say, Don, you just taught everyone how to do an ingrown toenail on your video. We're not going to have any business. Think that's going to happen? You could teach them how to treat plantar fasciitis all day long. Are they going to be able to do it? Can they do their own ingrown toenail? No. But when they watch your video, do they think that you're the expert? Sure they do. So this is called positioning. And so the more you can position your practice as the expert, it's going to be better. It's much better before than it is after. So if you could do anything, like my favorite thing would be, imagine this. Called up for the office, I'd like to make an appointment for, what do you have? We always ask, what do you have? I have plantar fasciitis. Oh, great, we'll fit you. Normally what do we do? I'll fit you in. That's it, right? Nothing else. Maybe you send them some sheets via whatever your app is to have them fill out the forms. But wouldn't it be great if you had some way, I'm going to send you a link with just some patient information about that topic. And we have a system that integrates with our electronic medical record. It's called Patient Education Genius. Sends them one link about plantar fasciitis. You could just do it based on, sometimes they don't know what they have, so you can send a generic one. Or even simpler, you could just put one link on your website that says, before your visit. And you could say, we have a website, we have a lot of information. A lot of patients, they want to learn about their condition, because how many times do you get patients that come in, they say, what can I do right now? I have a wound, I have plantar fasciitis, I have an ingrown toenail, what can I do? You say, sorry, you have to wait for your visit. But if you say, we have this page, it's before your visit, and on there you would have some of the most common things, and then they could get educated, they're not going to cancel the appointment. They're not going to treat themselves, but they're going to be really informed. And on there, by the way, you're going to have your testimonials, you're going to have patient reviews, you're going to have all these other things. So just a way to position yourself. Give them information about the doctor as well. So if you have a page like before your visit, and then you have information about the two doctors or one doctor with maybe some testimonials underneath the doctor's name, what does that do? It kind of builds them up. Wow, they had like 20 reviews about how great the doctor is. That's what you can do with this. So all of this is positioning. You can do testimonials. You can do a welcome video. It's real easy nowadays. Hey, I'm Dr. Pelto. Welcome to the office. I'm excited to have you here. We put some information on this page that you can review before you come into the office. Might be helpful. And then I'll see you when you come in. So doing like a welcome video for the patients so they get to know the doctor before they come and see them. That's another way of doing it. Also a welcome book. I don't know if anyone likes marketing, but there's a concept called shock and awe. Has anyone heard of that before? Shock and awe is a marketing term that you want to shock the patient before they come in. Meaning, I have a welcome packet. If you go to centralmasspodiatry.com, you can click on Dr. Pelto. There's a welcome packet there. And what that welcome packet has is a 100-page PDF. Oh, how do you make 100 pages? Well, you can look at it. You can see how I did it. But it's 100 pages. It has like my Amazon affiliate pages. But you know what the first 20 pages are? Google reviews that I just copy and paste. So they're not going to read 100 pages. But the first 20 pages, that's all I want them to look at. They're going to he's a great doctor. He's a great doctor. Wow, you had a 100-page book. I couldn't read it all, doc, but you have it there. And so it's a way of positioning yourself before they come in. Okay, so that's the most efficient way to then reduce the objections that patients have to the treatment for your doctor. Okay. Other things would be, having patients fill out the paperwork before they come in. Use an iPad to do paperwork easier. Who has the iPad system where they fill it out before they come in? Yeah? Anyone else? Just one? You have the iPad. Who has like the 80-year-old patient that cusses you every time they have to do the iPad? I'll give you every time. I'll give you a tip. I'll give you a tip for that. And also making sure the referral is complete. So bonus, older patients use staff to fill it out for them. Because what happens is there's like an argument. I don't know if in your office, but this is how my office is. We have the front office and the back office. And the back office says, well, it's the responsibility for the front office to get that darn paperwork, and that's what's holding me up. But what we've told the back office is get butts in the seat. Okay? Put butts in the treatment room. So they take the iPad from Mrs. Jones that's 80 years old, they put their butt in the seat, and then they actually do it for them. Okay? Do it for... They're 80, come on. Like, I'm even starting to have... I was just talking to Randy over here. We're trying to like it. I couldn't even figure out how to like the darn podcast. I'm getting there already. Okay? So put butts in the treatment room. So however you want to do that is you can use the staff to fill out that little thing. Don't be... Like a lot of times, they're just... The staff are in the back. They're just... They can't... And they're trying to figure it out. They're sweating. And just do it for them. They'll sign it with their finger. They can't even use the stylus. Like they don't want to use it. They use their finger and stuff like that. You have to help these patients. Okay.
We have somebody on, because Tuesdays we don't really see patients
Mm-hmm.
in surgery. We have somebody call new patients and referrals and kind of go over it ahead of time.
And fill out the paperwork for them. Yeah, that's perfect.
And then they just kind of have to review it when they come in.
Yep, so pre-filling out. So we have two methods. We have one that's an iPad, and then we have one where we text them, and they can fill it out via that text message. Some are high-tech, and they can do that, and they just review it when they come in, or you could have a staff even review it with them. This is what we use. It's something it's the welcome app. It has our doctor's information, and it lets them take a picture, personal information. They get consents for everything, pain assessment, review systems, all this stuff, and they can pay their copay. This is the one, every EMR is different, but this is the one that we use. And they can fill it out either on their cell phone before they come in or when they come into the office. It just makes it a little bit more streamlined. And they can sign, they can make payment. It reduces the administrative cost of doing stuff. I think all the EMRs are going to start having this. I think the one we use is called Frieza or something like that. Okay, that was kind of before. So we talked about how the doctors can position themselves and then how you can kind of simplify. Anyone else have any good before the visit suggestions to make it more efficient? Calling, anyone else? coffee before they come in? Like giving them coffee in the waiting room? Yeah. Having a good patient experience. We do. So we offer coffee and we offer water. We don't do it in the waiting room. When they go into the treatment room and they're waiting for the doctor, we say, you know, it's going to take a little bit. Would you like a coffee? So we do offer coffee to them and water and things like that. Go ahead.
I don't know if this will necessarily apply to everyone, but we do ABIs at our office, and we also, I do all of our MRIs, so a lot of times we'll have one of our girls on front staff kind of call patients ahead of time and let them know, like, hey, we're going to do this multi-segmental ABI, we're going to have cuffs that go all the way above the knee, so if you can go ahead and wear shorts ahead of time, or when I schedule my patients for our MRIs, I'm like, hi, it's a little cold in this room because we have to regulate the magnet. If you want to bring a sweater or wear shorts if we're scanning your knee because you're going to have to be pretty close to the machine and stuff like that. So that saves a lot of time because a lot of times patients will come in and get their ABI done and then immediately see Dr. Hunter after to review it. So that kind of saves time so we're not putting Dr. Hunter's schedule behind as well.
I like that. Telling them what to expect before they come in, it makes it easier. And I think patients feel more, because everyone's concerned. We're all worried. I get worried when I go see the doctor. Like, what am I going to expect? What do I have to do? Oh, gosh, I feel like an idiot. I forgot to wear shorts. I know they gave me that handout to wear shorts, but I forgot to do it for the ABI or anything like that. So that's ways to streamline before. Now we're going to talk about like during the whole encounter, okay? So how to streamline the office visit to reduce time vampires. This idea of time vampires is a term by Dan Kennedy. If you like kind of marketing books, he writes a lot of books about it. The number one tip, I think, is to don't let the doctor leave the room. Does anyone else have that rule? Doctor never leaves the room? Anyone? No? Try to. Isn't it horrible when the doctor leaves the room? Like, then they get behind, and then they go have a coffee, and then something else happens. And so for injections, what happens if they need a cortisone? What happens if they want an orthotic scan? What happens if they want to get an ultrasound or get x-rays? What do your doctors do if they're in the treatment room and then they need something? What do they do?
So for Dr. Wilkes, he will say, well, would you be interested in an injection? And then they'll say yes or no, and then the MA will walk out.
So he has an MA with him?
Yes,
okay.
at all times.
Perfect.
He is never alone. And then while he's explaining what's going to happen,
they get it.
MA gets it,
Perfect.
comes back, and has everything set up before he gives the injection. Right. That way he can do it and then leave.
MA in the treatment room. That's great. Anyone else?
So for like new patients, we automatically x-ray pretty much all the new patients.
That's the key,
and
I
then
think.
If we know like they're coming in for plantar fasciitis, they're more than likely going to get an injection, so we'll have it down in the tray already. But if not, like, I scribe for mine, and then I'll walk out and get one for them.
You walk out. And what happens if your doctors are alone in the room? How do they get a hold of you? Huh? Open the door? Yeah? Open the door? Anyone else have a system? I used to have the cracked door system. Okay, the cracked door system is I crack the door. But what happens when we move to a new office? In their desk, they couldn't see the cracked door. So what I used to do is I used to crack the door, then I went, you know, I'm hitting the door, closing the door, seeing if they'll listen to me, and they're usually doing 500 other things, right? Because you're not just kind of waiting there for the door to crack. You're getting x-rays, you're doing everything else that you have to do. So we have this cool system. I got it on Amazon for like $40. It's a pager. Anyone use this? What it is, it's a little circle that you get on Amazon, and what I do is, though, I hide it. So I kind of make I used to be a magician, so I make a game out of it. And so it's like right underneath the desk or somewhere underneath somewhere, and I say, yeah, I think we're going to have the staff come in and get an ultrasound for you, and I click the button. And then sometimes I play a game with the kids. You know, I say, I'm going to think really hard to have my staff come, and they start knocking on the door, and they're just amazed at how I do that. So I kind of make it into a magic trick, but really it's just a button. And then there's a little prompter out there that says, bing, room 1, and they can know what room I'm in. So because my staff are really busy, so that works really well. It's a little clicker system, so I never have to leave the treatment. The problem is when they get really busy, like I go bing, 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 and they don't come. So it still doesn't work if we're too busy. But that's what I recommend, so we don't have to leave the room for injections, orthotic scans, ultrasounds. Also, a way to reduce time vampires is to have frequently asked questions for a staff, so they don't have to ask the doctors. How many times do you get phone calls? And there's multiple ways you can ask the doctor. It might be within the EMR, there might be a texting, they might interrupt you. But I find that every time, this is what I do, is every time there's a question they ask me, I said, I'm going to give you the answer, but I'd like you to add it to the FAQ. So that whenever they have another question, like all the other staff, let's first look at the FAQs and see if it's in there, and if it's not, then I can ask the doctor. Don't waste time looking at X-ray CDs, okay? You know how we avoid that? We don't have a computer with a CD-ROM. Oh, you don't have a computer with a CD-ROM? Yeah. They bring their wonderful CD. I'm going to bring the CD. Oh, thank you. This day and age, just no one uses CDs. So I have to get new X-rays. And usually the X-rays that they get aren't weight-bearing. Okay? So I don't have a CD-ROM. Actually, I do have one kind of hidden out. It's one of these. It's hard to find a CD-ROM and sometimes we can look at them online and things like that. Get new weight-bearing X-rays. And I think the key is what you said. What was your name?
Logan.
What Logan said is getting X-rays. So my staff always know to get X-rays for everything musculoskeletal. And this is a practice management tip. A lot of times they're getting X-rays on things I probably wouldn't get X-rays on, which is probably good for practice management.
Have a baseline too.
A baseline. We don't do X-rays on everyone. We don't. We don't just do routine baselines. We do it based on usually pain. That's kind of the thing. But a lot of times they're coming in for, if I would look at it, it's a painful porokeratoma. I'm not going to get an X-ray for that, but a lot of times my staff does. I don't mind, and the patients don't mind, but we always get it before. Another tip to keep doctors on time, this is what I do. So I remember back in the day, I learned from the academy, what you do is when we used to actually carry films, you just carry the films in with you and you just tell the patient what was on the film. You don't look at the film because they always ask you about those two little white dots, which are the sesamoids. So I do kind of the same thing. What I do is I look at it in my office with my scribe and I dictate what's going on, and then I go talk to the patient. And I don't go over the X-ray unless they ask me, or if it's less like something surgical, I'm going to have to show them. But I don't look at the X-ray with everyone, and they don't mind. They just kind of trust. When I do ask them, when they do ask me, then I have them, instead of giving a CD, they always ask, can I have a copy of this? And I say, you know what, just take your cell phone and take a picture of it. That means, so if they break HIPAA, they're breaking HIPAA, I'm not breaking HIPAA. So they can take a picture of their own X-ray and share with whoever they want, and I don't have to give them copies of the X-rays. Okay? And then scan versus cast for orthotics and AFOs. I've casted for many years to do it faster. We did a STS cast, and now we scan. I know there's different approaches. Some people think that the plaster works much better, for example, for a very flat foot, and I still cast really flat feet. But for the most part, I was talking to a doctor the other day, and he had like 3 or 4 casting appointments where, I'm going to have you come back and do a casting appointment. I don't do that anymore. I hit my little buzzer, and they bring the scanner in, and we just scan their feet, and it takes literally 2 minutes. So if you get tired of doing, and it's an awkward position, you're like casting them, you're talking, and you just have to. It's not the most fun. So we do that for AFOs and things like that to make it more efficient. So developing protocols for prepping the rooms. That's what you guys have mentioned before. You have protocols. You know what to do for a wart, for an ulcer, for nails, for casting, for a uniboot. So this is something that I would suggest. Like in my office, there's 4 doctors, and I didn't realize this until later. And they said, well, Dr. Pelto, you have your way of doing it, and Dr. Feldman has his way of doing it. And I said, wait a second. Like he's the big boss. Like he's 10 years older than. How does he do it? He does it this way. Okay, so I'll do it that way. Why didn't you tell me you're like doing it different for me all the time? Because they don't want to displease the doctor. No, we're all just do it. And then what we have to do is we have to kind of sell, as the doctors amongst ourselves, we have to sell the reason why I really want to use Coban and not tape to do my ingrown toenails. And if we sell it, then we're going to go back to Coban. But Coban's more expensive than tape and this and that. So we have to sell it amongst the doctors because it's hard to train. It's not so much like you can get used to it, but it's hard to train new staff. Like, okay, Dr. Pelto he likes the tape. This one likes the Coban. What a pain. Try to figure out one way for the office and let the doctors kind of deal with it. Use index cards. This is how my staff does it. I don't know how you guys do it. I'll show you. So they do these things. I don't know if you can see this. So a card for Uniboot, for Matrix. See, NF and DP. So Neil Feldman and Don Pelto, that's the way they do the INDs. Prep the toes for the matrix, the post-op, the ward follow-up. So they have these little cards that they use, and it's easier to train staff. And you might do it this way, you might do it with something else that's a little more high-tech. Lesion excision, exhaustectomy, IND, matrix, BS, which is not BS, Ben Savvy, it's his name. So he has a different way of doing the matrix than we do. And then ulcer follow-up. So they use these little cards, and so when they're training new staff, they're always having those cards that are in there. I know this sounds really basic, but we measure the amount of tape, and because sometimes you get like the tube sock thing is like this long from one staff and like this thin for another staff. So we have actual lengths as they're learning how to do it. We put these cards so they know how much of this tape to cut when we're doing the ingrown toenails. It sounds real basic, but it makes it a lot easier for training, and it makes it much more efficient that we have the same way of doing it. This is something that we talked about. Get imaging before the doctor arrives. And I always say, when you're in doubt, get x-rays. Scheduling other imaging and procedures at the next visit. This is something for the doctor. This is what I do because I want to enter that room and I don't leave that room. Like maybe I'll leave it. When would I leave? If I'm going to do like numb someone up for an IND or something like that, then I'll numb them and then go see another patient. Okay. But normally what I do is if I want to do something, I'll schedule it at the next visit. So for example, plantar fasciitis, we all treat. They'll come in, they'll get the x-rays, and then I never do the ultrasound that visit. I'm always doing it the next visit. First of all, because I prepare the patient. I say, next visit, we're going to do the ultrasound. We're going to try these other things first, the night splint, all these other things. And then the next visit, in the schedule, it says ultrasound. So the ultrasound's ready in the treatment room, and then I can do the ultrasound. Same thing with Cariflex. I hate adding on Cariflex. They take forever, ever. Also, x-rays. A lot of times I'll get an x-ray the next visit if I'm running behind. Instead of saying, it's really not going to change our treatment today. You're having some ankle pain. I'm going to see you in a few weeks, and we'll get an x-ray at that time. And then we have different ways of explaining things. So this is what I do at the next visit. We're going to set up 3 sessions of shockwave with an ultrasound at the first session, and then an amniotic stem cell at the second visit based on your ultrasound. So I have these ways, and then my scribe, he writes these things as they're when they go to the checkout. So hopefully he writes faster than they can arrive in the checkout because we don't use paper. We don't use a super bill. He just writes things in there, and hopefully it shows up before they get out there. So these are suggestions here. Like I said before, doctor suggestion, review the x-rays before seeing the patient. Use a scribe to help with documentation. My scribe helps me with a lot of things. They order my medications, they schedule surgery, they tell the staff to check on AFOs, they review my lab results, and they whisper in my ear. I have a virtual scribe, but they whisper in my ear. They tell me what the patient's coming in for. He tells me if they need a diabetic foot exam. He tells me if they need an ABI. He tells me everything. Okay? And so you can use these people more to make it much more efficient. I personally like to use patient presentations and treatment sheets, and I'll tell you, and you'll get these after the conference. You can kind of copy mine. Oh, this is something real simple. I don't know how you do it. But like in our treatment rooms, we have 6 treatment rooms, and they put a little sticky on there with the patient's like initials or first name only, so it's not breaking HIPAA, what they're in for, so we kind of know. Because a lot of times I'm going room to room to room. I don't have time to look at the EMR, and so I'm going to one from, and so it says Stacy, she's here for an IND. But the cool thing is then I take that piece, that sticky note, and I put it on the pathology. When I take a nail sample, I just put it right on there, so they know it's for that patient. Because my handwriting's not that good. I just put like right hallux or whatever I'm doing. I talked about sharing x-rays. So quickly, these are the patient presentations. If you want to see these, you go to patientpresentations.com. They're all there if you want to steal mine. Nail fungus, I pull this up in the treatment room, and I have these for everything that I do. Feel free to steal these, have your doctors use them. I go over these. I have like usually, this is 6, this is a little bit more, but I have the typical questions that they give me and my whole protocol for these. We don't have time to go through these. This is just how I do it. It makes it a lot easier, and I record these as videos as well, and I give them to the patients afterwards. This is, I have for everything that I do. You might want to consider it, like the treatment sheet. So first visit, nail sample. Second visit, review the results, get LFTs. I have the address of the lab, oral antifungal daily, biotin daily. The booster is the next visit. Some things to remember, if anyone else in your household has the complaints, they should be evaluated. Remember the nail grows 1 millimeter per month. And then to prevent recurrence. This is why all of my patients get a UV light and shoe spray, all of them. Because I click here, antifungal UV light, shoe spray, wash your towels, things like that. So I have a whole process. And I have this for everything. If you want to look at them, you can go to patientpresentations.com. That's where I have them all. Those are just the ones that I use. You can make them your own. Post-op care plans. Once again, I'm really clear about how to do things. In the past, what I used to do is, oh, just buy that light or buy that shoe spray. Okay? When I did that, no one ever bought it. But what I do now is I'm very clear. I want you to use the shoe spray once a week, and I want you to use the shoe sterilizer once a month. So they have a plan. The callus, I want you to use the urea cream once a day. So I'm really, really clear about my Pelto special. This is things I do over and over and over. The Pelto special is a morning stretch, foam roller, and then foam rolling in the evening, and the night splint in the evening. So these things. Streamlining checkout procedures, the billing tab in the EMR, the memo section. I don't walk patients out. They kind of go out. And then packages. I'm a big package. It makes it a lot easier for scheduling. They'll get 4 Swifts, 3 shockwaves, a 3-month matrixectomy, yearly vascular studies, things like that. So finally, after the visit. So that was during the visit to make it more streamlined. Now after the visit, use the website. The same page that you have on the website before, you can share that with them after with the video, your blog, including the request for a review. I'm a big advocate of these treatment sheets. Encircle what you're going to do next. So let me explain. Oh, and for the doctors, on the day sheet, I highlight who I want to call or who I want to send a card to. This is what I use in my pocket. So I have this in my pocket in a prescription pad. And what it is a foot treatment checklist. So it's basically for everything that's musculoskeletal, and I fill it out. So for example, Achilles tendonitis, when the next appointment is, I circle what they're going to do next visit, and I X what I'm going to do. So I do this for every single patient. I have the whole page ones, but these are a little bit quicker for me, and it's in my pocket. And these are the treatment sheets, which are for like other types of conditions that I just talked about. So ways of making it more efficient. Any questions or any other comments? We have about 2 minutes. If anyone else has any efficiency techniques. Okay, thank you.